What's the hands-on analysis look like that you do?
So there's hands-on, there's hands-off, right? The first thing I typically am going to do is just evaluate opening, right? We should have 35 millimeters roughly of opening or more. The quick, easy rule is the rule of three,
yeah,
right? Yeah, the
that.
rule of three. So if you can fit 3 of your knuckles, and I like to do these knuckles, the first ones. I think technically, according to the studies, it's actually the second set of knuckles, but you don't need to stick your fingers that far into your mouth. But if you can fit 3 fingers between your top and bottom teeth, comfortably.
I'm going to use that as a thumbnail, by the way.
Yeah, right here. You have normal jaw function, okay? If you can fit, more than 2, but not 3, we're still borderline normal, starting to get into dysfunction. If you can't fit 2, now we're getting really dysfunctional.
Okay.
And if you can fit, for example, more than 1, but less than 2, we're in that medium dysfunction. If you can fit less than 1, we're severely dysfunctional, okay? So that's the first thing, assessing opening, right?
Somebody can do that at home.
You can do that at home. So you can determine, do I have limited opening? Might I have TMJ dysfunction? Can you fit 3 fingers? That should be normal. If you can fit more than 2, you're still close to normal. Once we start getting to 2 only, like barely 2 or less, now we're starting to get into the dysfunction territory. It's time to go talk to someone about that. The other thing is lateral excursion. So the vertical line between your 2 front teeth, so your 2 front top teeth are separated by a vertical line, and the 2 bottom front teeth are separated by a vertical line. Those should be roughly even. It's okay if your bite's not perfect, right? So lateral excursion is our ability to move the jaw side to side. You should have roughly 1 tooth's worth of lateral excursion. So if the bottom line can't go 1 full top tooth left, 1 full top tooth right, in excursion, then we are dysfunctional. We have less than full movement. So those are the first things.
Somebody can also do that at home.
You can do that at home. If you want to make it really easy, and I don't know if you want to do this, but you can use eyeliner to just mark the gap on your teeth. You open your lips and you just shift side to side. So you go.
Interesting.
And you look to see how much excursion there is.
I like that.
I also want to look at what the condyles are doing. So the condyles, I can feel them in front of and below the ear. Sometimes when people open, we get kind of one condyle that starts opening first, the other one catches up. That might be a sign that the one that's late to the party is restricted. Sometimes we get this big shift. So as we start to open, the condyle juts out and then corrects. That usually is accompanying some type of disc dysfunction. Your jaw may take a weird path. So if you look at the tip of the chin as the jaw opens, we should get a straight down, straight up pathing. So it might swing to the side and then correct. That's usually a disc dysfunction where we start swinging left, then we snap up onto the disc and our jaw position corrects. And then on the way close, a lot of times we fall off the disc and we swing out left again on the way up. So we go whoop, whoop as we open and close. Or you can get a deflection where we never get back on the disc. And so the jaw kind of stays off to the left all the way down, and on the way up, it returns back to what it was doing. But at maximal opening, the chin stays all the way left or something like that. We would call that deflection. It's a deflection. Versus a deviation, it kind of starts to go left, then fixes itself and comes back to midline. These are all giving me clues about what side's involved, whether the disc is involved or not, and how functional we are. If you've got less than 2 fingers of opening, hamburgers are off the menu, steak is off the menu, right? All these types of foods, sandwiches are off the menu. You're looking at, smaller foods. And if you've got less than 1 finger, we're on like liquid diet. I mean, these people have TMJ so bad, it's smoothies and protein shakes, and that's all they can eat.
And that's just progressively making this worse, obviously, because they're not using the muscles.
You're not using the muscles. And you're also now modifying your nutritional intake. That's another stressor for your nervous system. Okay. It's another thing that could potentially lead to inflammation. So we want to start to look at those.